For our daily briefing, I want to share some good news. We do have patients that are being released and coming off vents, which is very uplifting to the stats. It changes all the time, so it's tough to really report to you. But there is good news coming through the treatment of this. On Wednesday, we will have Dr. Ina Selenix here talking about convalescent plasma. It has begun here. That's the first time we can get her, so check in on Wednesday to learn more about that. Quick announcement, primary care offices are open in person through telemedicine. Emergency departments are open for non-COVID things. There's been questions coming from patients about, is it okay to keep my annual appointments? Is it okay to come into the emergency department? Absolutely, it is okay for those things. Those are the things we've set up to make safe entry so people can continue with those things. John is going to talk about inpatient numbers as he always does and discuss some additional screening options that will soon be available here that we're working on. So with that, I'll get right to the numbers and hand it over to John. Our inpatient census at midnight was 328. The screening visit, easy visit questionnaires, we've had 9,993 completed, resulting in 2,973 easy visits, and 1,375 of those have used the Como Provid code. Testing numbers continue to tick up. As evident, it's great having some of the in-house capabilities and the commercial labs continuing to do a great job. We have tested now 1,906 individuals at Bryan, 98 positives, 1,783 negatives, and there are 25 pending. Great to see the pending numbers staying low. That means the testing is being processed more rapidly.
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center, and to just break down the numbers a little further, we have 9 patients that are in-house that are either positive or pending COVID results. 5 of those individuals that are positive in-house, 1 is from Lancaster County, 4 from outside the county. Of the 4 that are pending, 2 are Lancaster County, and 2 are from outside of the county. We have 4 individuals on ventilators. All 4 of those happen to be individuals from outside of Lancaster County. In our ICU, we have 5 individuals, in our progressive care 3, and in our general care 1. But the real exciting news we want to mention to you today is we're working on a mobile testing vehicle so we can go help rural hospitals as well as spots within Lincoln. We should have that up and running by this week, and that'll be like a RV. We'll have people suited out in PPE. It'll be a drive-through type scenario, so we can get to those communities, to maybe where the people don't have transportation to come to our hospital. With that, we'll take any questions that anybody might have.
So flattening the curve, basically, it doesn't remove people from the curve; it just squishes them out. I don't know. There was a lot of motorcycle noise Saturday night and a lot of traffic. If people were around town this weekend, we just want people to be really diligent with their distancing. It's been that combination of spring break, as Dr. Norris said, gave us a break. And then if you look at places like Bryan, the university, some state governments, we have a large percentage of patients working from, or not patients, members of the community working from home here, which absolutely helps flatten the curve. People can't let down their guard. And again, flattening the curve will keep the same amount of people in. It'll just be spread out over a longer period of time.
I think right now people are aware that availability of testing is in short supply. So right now, I don't see that as happening. Maybe in the future, as we watch across the United States, that some of what we call those hot spots aren't as hot anymore, that more of the testing supplies become available, then I could see that happening. If you've watched in some of those communities, they are literally almost testing anybody that would come forward. But right now, I don't see that in this area. But I do want to reemphasize what Bob talked about. You know, folks, we cannot let our guard down. We have to keep this social distancing we should be proud that we flattened the curve, but it could easily spike if we have groups of folks get together again and people just kind of let their guard down. So stay diligent to what we're asking people to do. I think some of the reason for the low numbers is just due to the fact if people are social distancing, we're not seeing large groups get together and see outbreaks that are happening in other areas. But that's one of the reasons why we're looking at the mobile scenario, because we're wondering if people are having difficulty maybe with transportation or how to have access. There could be language barriers, a variety of different things. So before an outbreak would occur, we're going to be working with the health department to look at, are there areas of this community that we're not servicing? We have our location at the south side of town. We know CHI has one on the north side of town. We're starting to do some analytics to see where our populations are coming from for the drive-through, to see if there's pockets within the community that are not being serviced. And if we find that to be true, we'll set up the mobiles in those areas. Plus, we want to make sure that we're always available to our rural hospitals to assure that we have the capability of coming out to them if some more tests need to be administered in what we're calling hot spots or areas that we think could potentially become a hot spot.
I don't know the detail, but if you watch this thing over a long period of time, not just through this, usually Monday and Tuesday are a little bit lower as then people go in to see their physician or have things, and you'll see it raise later in the week. As far as more dismissals, fewer admissions, yeah, that's the equation there. But if it's like a routine week, it'll climb throughout the week.
I think one of the first communities we may go to is in the Crete area. One, because we do have a hospital located at Crete, and that may be an easier place to set up, just to assure that we're giving access to individuals in that part of the community. As we work with other hospitals and they either have a positive or an individual that they highly suspect to be positive, we're seeing those transfers come to Bryan Medical Center. It's kind of hard to just throw the switch and say, okay, all elective surgeries are available again. We have to look at a plan of how we would introduce those gradually, because one of the key aspects that you're going to see is you're going to use a lot of PPE when you start elective surgeries or elective procedures. I think you'll see more people wanting to wear masks than maybe wore them in the past. And just as we enter or have new patients come into the facility for those outpatient tests, I would believe that they would have to be masked as well until we could say this virus is at a stage that people would feel comfortable of not asking all their patients to wear masks. So when you look at it, you have to look at a plan of, do you gear it up 25% or 50% at what it was? See how we do. Do we have enough equipment? And then maybe you'll ramp it up further. But I do not see us just flipping the switch and all of a sudden all the elective surgeries and that just happen on a given day. We're looking at that revenue stream just like any other business is doing that. And, we can't go on forever with that, but we're looking at how long could you sustain that. We do have reserves, and that's what's been very beneficial about this organization. We're good stewards of our resources, and I have to give a shout out to our great board members that we have that represent us in this community. We're making sure that we have funds available when something like this would occur, or we would see a disruption in service. So yes, we do have a reserve, but you can't have this going on for months and months without feeling the impact, because we know what all these other businesses are feeling in this community when their doors had to be shut down. I probably guess that we're probably at about 65% of our capacity of what we used to have been before, and you could tell it's a big impact on the organization. We actually had our boards meet the other day. We did it, of course, virtually. We're updating them constantly. Our board chairs are very involved, as well as just our board members. We continue to give them updates. We send out information. They're able to ask us questions. They're just great ambassadors and advocates for us, fully supportive of what we're doing. Continue to give us feedback, and I can't say enough about our board members. We're lucky to have them in this community.